A 35-year-old male patient is diagnosed with injury to common peroneal nerve due to fracture of the neck of the fibula. Fracture of the neck of the fibula. Common peroneal nerve is damaged, deep peroneal nerve, and also superficial peroneal nerve is damaged. Superficial peroneal nerve is the nerve for the lateral leg compartment. Let us write down the information and then we can come back to the question. Say if there is a fracture neck of the fibula, common peroneal nerve is gone. Common peroneal nerve is dividing into two, that is the superficial peroneal nerve for the lateral leg compartment. And if we are talking about the deep peroneal nerve, which is also called as the anterior tibial nerve, is coming to the anterior leg compartment. Anterior leg compartment, we understand there will be the extensor Tom, Dick and Harry. When you say it is the extensor Tom, Dick and Harry, that is T is tibialis anterior and D is extensor digitorum longus and the extensor hallucis longus. So Tom, Dick and Harry. They are extensor, means they are basically dorsiflexors. The problem will be with dorsiflexion, as these muscles are not working, supplied by anterior tibial nerve or deep peroneal nerve, and there will be a foot drop. Not only there will be a case of foot drop, but there will be a high steppage gait. These patients, they start walking with high steppage gait because they have to clear the foot from the ground. So excessive flexion at the hip joint, excessive flexion at the knee joint also, that is what they will be having. We have a diagram to show that. Along with that, since the lateral leg compartment is gone, the peroneus longus, peroneus brevis is gone, and they are basically doing the eversion at the subtalar joint, so there will be problem with the eversion also. Plus there will be sensory loss on the dorsum of the foot. And as I am mentioning, they will have excessive flexion at the hip joint, excessive flexion at the knee joint, so as to clear the foot from the ground, because the patient is having foot drop. The lesion was actually here, lateral to the neck of the fibula here, and this is the sciatic nerve. Sciatic nerve is basically giving us two branches. One of that, common peroneal nerve, has been compromised here, lateral to the neck of fibula. That is why the anterior deep peroneal nerve and the lateral social peroneal nerve, they are gone. Social peroneal nerve means a problem of eversion, and deep peroneal nerve means problem of dorsiflexion. And since there is a foot drop case, it is a case of foot drop, you'll find that the patient is walking with excessive flexion at the knee, excessive flexion at the hip, so as what is called as high steppage gait. And we can go back to the question now. We already have found the answer. This is the patient who is having injury to the common peroneal nerve, fracture neck of fibula, and the problem is with dorsiflexion of the foot. That means the patient is having a foot drop. Not only the patient will have a foot drop, but also loss of foot eversion. Now, what about the other options? Like what about inversion? Actually, inversion, that is turning the sole to the inside, is done by two of the toms, the anterior tom and posterior tom. Anterior tom is the extensor tom, that is tibialis anterior, and posterior tom is the flexor tom, that is the tibialis posterior. Now, since this is a problem of common peroneal nerve, the anterior tibial nerve is not working, so anterior tom will not be working. That means the tibialis anterior will not be working. But tibialis posterior, which is supplied by posterior tibial nerve, is still working. So inversion is not a problem, though there will be weakness of inversion, because common peroneal nerve gone, so anterior tibial nerve gone, so tibialis anterior gone, which is one of the inverter. But the other inverter, tibialis posterior, supplied by posterior tibial nerve in the calf region, still working. So weakness will be there, but it is not that we lose it. Anyway, B is a better answer. What about choice number C? If you say flexion of the toes, then it is the, again, calf muscles. In the calf region, you have posterior tibial nerve, and posterior tibial nerve is not only supplying the tibialis posterior, that is the muscle which is working for not only flexion but also inversion. It is also supplying the, flexor Tom, Dick and Harry. Now, when you say they are flexor Tom, Dick and Harry, who is that? The T is tibialis posterior, the D is flexor digitorum longus, and H is the flexor hallucis longus. And these are the ones which are flexing the toes or flexing even the metatarsophalangeal joint. So the C and D, they are working fine because posterior tibial nerve is working fine. The problem is with choice number B. Choice number B is the best answer, though of course it will be affecting. So you can say B is a better answer than A, because still, dorsiflexion of the foot is gone. There's a foot drop, obviously. And there's a problem of eversion, actually, not inversion. Inversion will be affected little bit because this anterior tibial nerve supplying tibialis anterior is not working, so it will be affected. The question is asking which of the following is affected. So B is affected, A is affected, C and D is not affected at all because posterior tibial nerve and calf muscles are still working. So B remains a better answer than A, but still B is the best possible answer here.